This case demonstrates the Tensor Trans-Os tunneler to perform a partial articular-sided cuff repair without anchors. Our mission is to provide cost-effective, gold standard techniques for soft tissue repair in sports medicine. Shown here is a partial articular-sided tear of the supraspinatus, which has been cleaned out from a lateral portal. The transos is being introduced from the bursal side, viewing intra-articularly, to provide precise placement of the tunnel and retrieve a retrieval stitch through which 4 sutures will be pulled. The sutures have now been put into place, and these act just like an anchor which has been deployed for similar techniques. Here we use a shuttling technique with a low-cost spinal needle to ensure that we grasp the articular segments from the intra-articular viewing position. Viewing from the lateral subacromial portal, we are now passing Mason-Allen equivalent sutures or grasping sutures of the bursal segments to provide secure tendon fixation. In this patient, the bone was of good quality. A left curve device is then utilized to pass another locking loop to capture the anterior bursal margin of the supraspinatus. The locking loop is secured and another penetration is made, creating a very secure grasp on the tendon under tension. Two more simple sutures are passed between these marginal sutures to perform circumferential compression of the tendon to its anatomic location. Here the sutures have not been tied, and they are assessed for the order in which they will be tied. Here a posterior view shows the size of the tunnel. Anatomic secure repair allowing rotation is achieved.